We know COVID-19 is more severe for older people, and they are urged to stay home. Here to talk about what elderly patients need to know in this rapidly changing climate is Dr. Carmel Dyer, geriatrician with UT Physicians and executive director of the UTHealth Consortium on Aging. Thank you so much for being here. We appreciate it. Well, so we know that symptoms are mild for about 80% of us, but it is those older Americans, our parents, our grandparents, who we want to protect. So first, why is it so different for those who are age 60 and up?
So as we age, our immune system changes. And so as the immune system's strength wanes with age, and it gets worse sorely with advancing years, we're more susceptible to the virus.
And people, particularly younger generations, can be carriers without showing any symptoms. And that's why you've heard the calls lately, especially from millennial generations, to stay home and away from people. Is that right?
Yes, one of the most important things we can do is called social distancing. It's good in a way because it's not harmful, it's very safe to do, and it's prevention. And prevention always is the best treatment.
What if you want to visit a loved one right now who is over the age of 60 in a hospital or a senior center or a nursing home? Can you do that if you are feeling fine, or should that visit be postponed?
Well, right now the hospitals and a lot of the nursing homes are restricting visitors. They want to limit that as much as possible. They're checking people at the door to see if they have fever or symptoms. Now, if you want to talk about whether or not to visit somebody at home, I think you need to think about whether you've been around a lot of people. Maybe you're a healthcare worker, maybe you have a job that puts you with a lot of other folks. I think I would limit those visits. I mean, now we're so lucky there's FaceTime and there's telephone and it's video conferencing and Skype. But the other thing, remember in the old days we used to there were parlors where people came to visit. You could set up a place in a room where there's a 6-foot distance and somebody can visit, and then you wash your hands and you clean that area, and then the elder exits. But I would limit visits, though, if I could.
What about so many schools being closed, and many people are calling on their moms and dads who are grandparents to watch their children now at home? Is that okay for 60 and up who are in good health?
Well, it's all based on an individual basis. You could be a 65-year-old who runs marathons and all that and be very well and healthy, or you could even be 55 and have problems like asthma or diabetes or hypertension or even cancer. And so it depends on your health. But I think, we see the numbers in the deaths go up dramatically in the 80s and above, and so that's where we have to have the most caution.
Should seniors be going to the grocery store right now picking up medications, and what are the alternatives if they don't feel safe getting out to the grocery store?
Well, there's so many delivery services, and this is where younger people can help. If you have service hours you need, if you really want to help your grandparents, go pick up something for them, bring it to them, put a flower in it and leave it at the door. But that's a good way to help them.
That sure is. We're hearing of wait times now to get into the doctor, people calling and saying they have symptoms, and the doctor says, I'm sorry, I just can't see you right now. But for older people who are showing symptoms, I mean, what should they do?
So first of all, if any one of us, we just need a routine visit, we're well and all that, we could have a telephone call with the physician or put it off. It's just routine in the next 3 months or so. If you're having symptoms and they're mild, it's best to stay home. You can call the doctor and get some advice, but stay at home. The state and Medicare are working out ways we can do telephone visits and all of that. But if you are ill and you have cough, shortness of breath, fever, you should call the doctor before going to the office, because they may have other advice for you.
And then they're going to direct you on what the next step is, whether it's a test for coronavirus or whether you do need hospitalization. And we appreciate you coming in to answer all of our questions. Dr. Dyer, thank you so much.
Thank you for bringing good attention to this issue.